today with us.
Well, I appreciate the opportunity to join you all today. And I think we're going to share the screen with my presentation so that you don't just have to look at my picture or my face. There we go. The first thing that I want to do is just kind of share a little bit of information with you all, and then definitely just open it up for questions and see, you know, what kinds of things are on your mind, and if I can help answer those questions, or at least point you in a direction that maybe you can get some resources or additional information. I think the first thing that is most important for me as I talk about this in regards to mental health and coping with mental health in this coronavirus, the COVID-19 pandemic, is that we must stay connected, especially in the face of this public health crisis. You know, the world seemingly changed overnight, and we all need one another through these challenging times. It's important that we practice physical distancing, but stay socially connected. So really, I've really tried to focus on when people have talked about social distancing, really try to reframe that and say that while we need to stay physically distanced from one another to be safe, we still need to find ways to stay socially connected with one another. It's important for us to understand that emotional reactions are expected and that they are a normal part of the process when we experience events like this. Many individuals may be feeling fear, guilt, anxiety, sadness, depression, anger, and all of these feelings can result in behaviors such as being irritable or oversensitive, hostile, or short-tempered. And I'm going to guess that many of us have experienced that at some level or another. I think it's important, again, for all of us to recognize that no one's ever lived through anything like this. No one has experienced something like this, and that many of us are all having the same feelings. So it's a perfect opportunity for us to provide a little grace and kindness, along with some understanding to one another. And I think that's more important today than ever. In previous discussions that I've had, or communications or community events, I've often talked about that that civility is all but been lost, and that I've even said that it's been put on the endangered species list. I think one thing about the current environment and what we're experiencing is a perfect opportunity for us to change that narrative, for us to, again, provide a little grace, kindness, and understanding to one another, knowing that we're all going through this together, and all going through this for the first time. Again, nobody's ever experienced anything like this. Again, I want to stress that it's imperative that we maintain our physical distance from one another, but we are really social creatures, and we all must maintain our social connectedness. We really need to ensure that people do not socially isolate themselves. And so I think there's a couple of ways that we can definitely try to cope. The first is that we should structure our days and weeks. I've talked to a number of people, and as we've had the stay-at-home order in place, a lot of people will felt like, oh, well, this is just going to kind of maybe be an extended vacation. And for the first few days, they stayed in bed and kind of just took it more as a vacation, taking it easy. Unfortunately, as the days go on and as we move from days to weeks, it's really important that we establish some sort of structure. We all, whether we want to admit it or not, we and our bodies like structure. It tends to lower our anxiety. And so making sure that you have structured days, that you set your day up, that you set your weeks up in advance is really an important way that you can cope with the anxiety and depression and the feelings that you may be experiencing, or that people around us may be experiencing. I think it's important for us to talk to one another, utilizing phone or video chat apps like Marco Polo, Zoom, like we are today, Skype, or FaceTime. Again, while we're physically distanced from one another, we really need to find ways to be socially connected. We need to routinely make an effort to check on friends, families, and coworkers. Again, all in that effort to stay socially connected and not isolate ourselves, and be, especially aware of those situations where someone may be isolating themselves, and take that initiative to reach out to that person if you're concerned about them becoming socially withdrawn or socially isolated. I think we also all have to give ourselves permission to feel down. It's really okay for us not to be okay with this COVID-19 pandemic. And so we need to realize that it's all right to have days where you're just not feeling 100%. I think we have to be really focused on making sure that we get plenty of exercise, that we meet all our essential nutrition needs, and that we drink plenty of water and avoid using substances like drugs and alcohol to cope with this type of situation. Those kinds of things just continue to make things more difficult and result in more problematic behaviors and feelings. So avoid substances, alcohol and drugs, and drink plenty of water. And finally, if you need help, ask for help. And I'll mention this a couple of times today as we talk. Johnson County Mental Health Center maintains a 24-hour crisis line. That number is 913-268-0156. And over the course of the last couple of weeks, we've seen an increase in calls there, but we really want to make sure that people know that there is someone available 24 hours a day if you just need to talk. Typically, we staff that line with 2 clinicians. We have 4 clinicians now around the clock answering that phone. We've also had to maintain the ability for folks to walk in. So our clients and the public, if they need help, they can walk in at 2 of our locations, one in Olathe and one in Shawnee. And not everybody has technology, so it's a little more difficult for them to be able to maybe reach out for help. But there's always the opportunity to still walk in and get assistance. I think it's important for us to also talk about the ways that we can have these discussions with kids. And so I think it will be important for us to recognize that depending upon the age of the individual or the age of the child and their exposure to media, children may know more about the virus than we think. I think it's important that we definitely meet children where they are, understand their concerns, validate their concerns, and provide compassion to them. And I think it's also really important that we reassure them that this will end, that we can all take steps. And so by reassuring and empowering them, a couple of ways that you can do that is empowering them to take some control on areas that they can focus on. So we know that if you wash your hands and you use, if you use disinfectant or a hand sanitizer, those are all ways that you yourself can individually help prevent the spread of COVID-19. And so being able to reassure kids that this will end, and just reinforcing the notion that they do have some control on what they can do is really important. And I think the most important thing for me and what I've told people is that we really need to model positive behavior for young people. If we're freaking out about things, then they're going to freak out about things. If we take it nonchalantly, then they're going to do the same. And so really young people, whether they want to admit it or not, they often times take their behavior and the way they approach things by the cues that we give them. So it's important for us to model positive behavior. I would also like to just share with you a little bit of information about where you can find a host of information and resources, and that is on our Johnson County website. And there's a couple of things that I want to point out to you on the website. The first is that the information on mental health and the effects of COVID-19, there's a ton of information at the lower end of the page is regard of a bunch of resources that you can use, anywhere from how to talk with your kids about COVID-19 to how to prepare your home, all of those kinds of things. We also have an opportunity to participate in a weekly mental health moment email, which comes out each week. It provides some positive opportunities for kindness and connecting and coping. And you can sign up for that email right there where we were circling, or over on the right hand of the screen where it says need a mental health moment. That can also be a place that you go and sign up for that email. We also have a Facebook page, and I don't have that to show you, but you can definitely access the Facebook page right there as well. And it will have a number of different things. We're getting ready later this week to start, or actually next week, to start reading children's books for the individuals that we serve and their families. And we've received a lot of permission. Well, we've received permission from a number of national authors and publishers to be able to do that. Another opportunity is to listen to our podcast, which is our latest episode is called "It's Okay If You're Not Okay with COVID-19." So that's something that you can also participate in, and we're going to try to focus our most recent episodes on that information. And so there's, like I said, there's a ton of information there. The one thing that I did want to point out at the top of the web page, and I know that many of you received this information. We are currently, our public health department is currently trying to get a population health survey, and it would be really great if as many people could participate in that survey as possible. It's a really simple survey, a couple of quick questions. We'd like to have it done for every person in the household, but that's going to give us a lot of information that we can begin to look and see how COVID-19 is either spreading or not spreading in our community, and what actions and what areas we can target specific responses. So we have about 51,000 responses so far, which is unbelievable, but we would really like to get as many as we possibly can. So I encourage folks to go and do that. I think as I wrap up and look for your questions, I think that, again, the biggest thing that we can do is find ways to support one another, help people access the services that they need to access. So if you're just not sure, you can call our 24-hour crisis line. If you just want to get guidance about how to approach someone or how you can connect someone, don't hesitate if you just have a question to call our 24-hour crisis line. Again, that's 913-268-0156. And with that, I think I'll open that up to questions and see what all you were hoping to get information about, or what information you really wanted to know.
And if you have a question, please just let us know in the chat and we'll unmute you so you can talk directly to Tim.
So I'm waiting, while we're waiting to see if anyone has any specific questions, I might also just add, as I mentioned earlier, that that we have currently our crisis intervention and our medication services are being primarily provided by telephone and televideo. However, in many instances, face-to-face interactions are required. And some examples of that are when residents may not have access to technology. There's other examples like providing long-acting injectable medications, conducting suicide assessments or mental health status exams, or also when we're responding to law enforcement. You know, we really anticipate over the next several weeks experiencing a higher level of need as individuals experience more acute psychological distress as a result of the weeks that pass, and all of the uncertainty and the financial position that it's putting many businesses and individuals and families in. And therefore, we've maintained, like I said earlier, the ability to walk into our crisis clinics for the public as well as our clients. And in those two locations, the first is at our Olathe office at 1125 West Spruce in Olathe. And then the second location is at our Shawnee office, which is at 6440 Neiman Road in Shawnee. And again, either one of those places, we can have folks walk in. We ask that you call, but first, but definitely don't have to do that. You can simply just walk in.
We have a question from Commissioner Hanslick.
Yes.
What are some of the most common concerns that people who have called into the hotline?
I think some of the most common concerns are just really about the anxiety of not knowing. I think a lot of people are experiencing symptoms that they immediately associate with COVID-19. So, you know, we also have just our regular flu. We also have allergies and things like that. And so people, if they get a sniffle or a sore throat or they start to cough or have a fever, immediately go to the biggest concern. And so I think we have, we have a lot of people that call and want to get direction on what the best answer is in that regard. I think that the other thing is that people want to get tested, and so they ask about how you can get tested. And while testing is not necessarily available to the entire public, the fact that if you're experiencing some symptoms, regardless of whether you know or you don't know that it's COVID-19, that the direction is really going to be that you simply take care of yourself, that you monitor your symptoms, that you do what you need to, that you drink plenty of liquids, that you stay at home so that you don't possibly provide the virus to someone else, whether you know you have it or not, and that if you get to the point where you're having breathing difficulties and things like that, that you need to call your doctor. Again, not just go to the emergency room, but call your physician and get direction from them. And so in many of the cases that we're getting, and the calls that we're getting right now, we're encouraging people to contact their physician to talk about those physical healthcare issues. You know, the one thing that I think is important to realize is that the physical symptoms and the physical illness of COVID-19 are going to impact some people. I believe that the emotional impacts are going to be on all of us. We're experiencing things that we have never experienced. And so a lot of the calls that we get right now, there's definitely an increase in folks feeling depressed, feeling fearful of the unknown. And it's a matter of being able to help people kind of just refocus and really set focus on that emotion regulation and what we mean kind of staying in the moment and being mindful about what's going on with them at that time. But that's really kind of right now the focus of the primary focus of the hotline calls that we're getting.
Other than the county website, are there other resources online we can access?
Yeah, you know, I think that there's a plethora of information out there, but I think you have to be very careful about where you get your information, because that can be as detrimental as it is maybe consoling. And so I think that you want to make sure that you're getting your information where we tend to focus our information on is we tend to focus on the CDC, getting information from that resource. And in the majority of the information that we place both on the Johnson County website as well as the Mental Health Center website is information that is specific to the information that we're getting from our public health department and the CDC. So you want to make sure that you're not just kind of floating across the internet abyss and picking up information from all kinds of places, because you have to make sure that you're getting realistic information. And so I would encourage people to get their information directly from the CDC. And I see that on our Zoom chat that both of those websites are up there, the CDC website as well as the Johnson County government website. Everything that you need to know about COVID-19 and this epidemic or pandemic, excuse me, in our community, that can be your number one place to get information.
Did anyone else have any questions?
Tim, thank you so much. I have one comment that maybe you can comment to. I know that we are being bombarded with information on the media as well. I think it's good to stay in touch with what's happening, but can you kind of give us a little direction of maybe how much is too much?
Absolutely. I think that's always a good question, because if you would have talked to me about 6 weeks ago or 8 weeks ago, in many situations before the first of the year, I was going around talking about the impact that technology was having on families and the unintended consequences of spending so much time on our phones and our electronic devices. And now 6 weeks later, I'm sitting here saying, hey, we need to make sure that we use technology to stay socially connected. The point is that technology provides us so many amenities, and it can keep us very connected to people and making sure that we don't isolate, that we communicate well, that we get good information. But there are definite downsides to having that technology always available to us. And so I think that we have to make sure that we monitor ourselves in what it is that we do. Some of those kinds of, just sitting and watching CNN or Fox or NBC, any of those news outlets, 24 hours a day, 7 days a week, me doing that, I would feel anxious and unsettled. And so what we have to do is make sure that we do things in moderation. We talk about doing, that if we do drink, that we drink in moderation. If we do consume media, we probably need to consume it in moderation. And I think a lot of times I get asked, well, what's moderation? I think that if you're involved in technology and watching so much information that your anxiety or your fear is impacting your ability to function on a daily basis, whether that is that you just can't move away from the TV, or that you can't put down your phone, or that you are irritable or hostile towards other people, or impacting your family, or maybe you're being a little short with your kids. Those are the times where we have to step back and say, enough is enough. Maybe I need to rethink what it is I'm doing. So when we talk about moderation, really we're talking about when it starts to impact your activities of daily living, your relationships that you have with other people that are important around you. If it starts impacting that, then you really need to adjust what you're doing.
Again, thank you so much. I don't know, are there any other questions that we want to have answered before we say our thanks to Tim for joining us today? Well, you've given us such great information, and not only that, but resources. And that's what the NEJC Chamber is trying to do as well. On our website, we have recorded this so that if somebody was not able to join us, or if you know somebody that would benefit by listening to Tim's words, please go out to our website and share it. I particularly liked hearing about the email and the podcast that you have. So again, thank you so much for taking your valuable time and helping to educate all of us during this crisis.
You're welcome. One thing that also came to mind as you were speaking is that, right now we as the mental health center are really kind of in crisis mode. We're helping folks in the here and now just develop a plan to how to get by day. The thing that I'm most concerned about beyond today and the next 6 weeks is, what is this going to mean for our community? What is it going to mean for our business community 6 months from now, 8 months from now? And I think that's what we also need to keep an eye on, is that we'll get through this. We'll get through the pandemic, but then we're going to have to get into a recovery mode for both ourselves, our community, and our business community. And so it'll be important that we have this kind of dialogue over the course of this next year, I believe. So thank you for the leadership, and thank you for the chamber bringing this together. I really appreciate it.
Thank you again. You have a great day, and all of you stay safe and healthy.
Thank you.